People are still joining us. Good morning, everyone. Thank you for making the time to be with us. My name is Samuel Oti, and I'm a senior program specialist with Canada's International Development Research Centre. We are a Canadian funding agency, and for the past 50 years, 50 plus years, we have been investing in research on a variety of development issues across low and middle income countries. But before we start, allow me to rant. Just I promise it'll be a very, very short rant. So when I was growing up, I learned the word fact. And when I learned that word, the word fact, I learned that it was absolute. If something is a fact, it's a fact. Full stop, right? And for example, if someone was arguing with me about gravity, I'll tell them, okay, just climb up a tree, jump, and let's see what direction you go. Absolute fact, right? But now, fast forward to today, and I heard a new framing, alternative fact. And I don't know about you, but every time I hear that framing, my brain just gets scrambled. What do you mean, alternative fact? I thought facts are absolute. And unfortunately, the topic for today, vaccines, has been a subject of alternative facts. Even though the science shows that vaccines work, they're effective, they save millions of lives, we now have an entire movement that is anti-vaccines because they believe in alternative facts. But I'm so glad that African heads of state do not believe in the alternative reality of vaccines. And that's why they have made a commitment that by 2040, Africa should be on its way towards self-sufficiency in vaccine manufacturing. But how do we get there as a continent? We can't get there alone. We need the private sector, and we need development partners. And the topic for today is about how the private sector can catalyze vaccine innovation for Africa. So I'd like to welcome you all and talk about the process for today. We are going to have opening remarks, and right after that, we'll have a keynote. And after the keynote, I'll invite our distinguished panelists to the stage, and then we'll have 2 rounds of questions, and then we'll open it up to the floor. And I'm a very mean moderator, so I'll be very strict with the panelists, so just giving them a heads up, because I really want the audience to be able to participate. And so if you can keep time, we'll create an opportunity for the audience to participate. So without much ado, it is my pleasure to welcome to the stage to deliver the opening remarks to Manuel Martin Lozano. He is the strategic advisor at the Rwanda Development Board. Manuel serves as an expert in the private sector development, who is currently working with RDB on building the pharmaceutical and advanced healthcare sectors in Rwanda. You are very welcome, Manuel. Please put your hands together for him.
Thank you very much, Sam. Thanks to the organizers for setting up this session, and thanks for everyone for attending this this conference and this session in particular. I think it's fantastic that we decide to focus in this particular topic, which sometimes is overlooked, which is the private sector and the role that the private sector has in developing an innovative industry like this, like vaccine research and manufacturing. This is something that not all countries are prioritizing as much. So I think it's a great idea to start with opening remarks, conveying the case of Rwanda and what Rwanda has been doing to develop the ecosystem here. 3-4 years ago, in the middle of the COVID pandemic, a number of African countries made significant or several announcements about how they're going to be building vaccine manufacturing capacity. And Rwanda was one of them. But the difference here in Rwanda is that the announcement was not made by the government, it was made by a private company. And I think this showcases our approach and how we try to develop a sector like this. So if you allow, I'll get into a bit more detail, and I'll explain you briefly why or how Rwanda is trying to develop this sector by building, this vaccine manufacturing sector, by building on or trying to attract more private sector investments. And I hope this helps to have a fluent and enjoyable panel session afterwards. The government of Rwanda has always been very, very open to developing the private sector, right? We are one of the few countries in Africa that has no restrictions on foreign ownership, no sort of form of capital controls, and we try to establish a very, very easy pathway to set up and operate a business here. So in that regard, private sector or developing the private sector is the way for us to build new industries, right? However, it's important to note that the government can take an active role in some occasions, and it should take that active role instead of just simply letting the private sector operate. And that's what we realized that we had to do if we want to build the vaccine manufacturing ecosystem here in Rwanda. So what we saw as our anchor tenant or anchor investor in the country, BioNTech, came in, is that we need to build a couple of enablers that have to be there for pharmaceutical manufacturing and in particular vaccine manufacturing companies for them to be able to come here and thrive, right? And we have been identifying those enablers and working aggressively on setting them up. I'll walk through them briefly, but the first one is a regulatory environment. So Rwanda FDA recently achieved maturity level 3, which is unfortunately something not that common in the continent. But we wanted to make sure that companies here, that manufacture here, follow the standards that companies in more advanced countries, more advanced economies have to follow, to make sure that Africans that get access to medicines from here get medicines that are of the same standards of those of the West, right? And we realized that companies coming here appreciated that their products being done in Rwanda are perceived as of the same quality as elsewhere. So that's an important enabler that we work on building. Another initiative that we have been working on is on developing human talent, right? Here in Rwanda, unfortunately, we didn't have a lot of pharmaceutical manufacturing capacity a few years back. And we had to start from the very beginning, right? But we had a lot of support from development partners that help us to build a number of programs from a number of different education programs, including PhDs, masters, technical programs at vocational schools, that are helping us on building a base of Rwandan talent. In addition to that, we have launched a number of different initiatives to upskill or talent that is available in the country, maybe in other sectors, but in order to make them or to prepare them to work in the pharmaceutical sector. We have also been working hard when it comes to the innovation side of things on creating an ecosystem, particularly for clinical trials, that allows companies to come in and do the research here. When it comes to vaccines, we realize that only focusing on manufacturing is not the way, right? We want to help companies to be able to test new products and develop potentially new products here. And that is actually the topic of this session, right? So vaccine innovation. So here in Rwanda, we acknowledge or realize the fact that Africa is quite neglected when it comes to medical research, right? Only 2% of clinical trials all over the world are done in Africa, although the burden of disease that this continent bears is around 20%, right? So we have been trying to build the basic regulatory environment and to build capacity at our hospitals and other research facilities to be able to allow for companies that manufacture vaccines to develop those or to look into how to develop them and how to test them here in Rwanda. And maybe a last point that we are working on as I speak is on infrastructure, right? Again, like I said, the development of this industry in Rwanda is very nascent, but we can see that those countries that have an advanced pharmaceutical manufacturing ecosystem, they tend to have clusters, right, and have companies clustered around different areas. And apparently that's mainly for two reasons. One is for economies of scale, right? So there's a number of shared infrastructure and shared facilities that companies want to share and utilize jointly. And there's also an opportunity to collaborate among companies when they are close to each other, right? So we decided to develop here in Rwanda what we call a life sciences park. which will be an industrial park dedicated to pharmaceutical and vaccine research and manufacturing. We intend to set that up in our special economic zone. So this is an initiative that we are currently working on, primarily with the International Finance Corporation. We intend to develop it over the coming years, and we think it's going to help us to catalyze the ecosystem. In short, those are the four key pillars that we have been working on in order to establish this sector. In addition to that, we have been trying to push a lot from the investment promotion front, not only in order to attract companies, but also to attract other type of partners, like for instance, the International Vaccine Institute, or multiple other development partners from Europe and from other countries that are helping us to build the basic enablers of the ecosystem and catalyze the sector. And as a result, we have achieved quite a bit of progress, right? So in a matter of 3-4 years, you can see that a major vaccine manufacturing company, a quite innovative one, is soon going to start manufacturing vaccines, but not only manufacturing them for commercial purposes, but also manufacturing vaccines for clinical research. And I'm talking about BioNTech. I'm sure we'll be able to hear more about them during the panel session. But in addition to that, we have a number of other organizations that have set up shop here. For instance, IVI, the International Vaccine Institute, like I was mentioning, or the African Clinical Research Network, which is going to be focusing, among other things, on developing new vaccines and other products. That's a quick overview of the sector here and of what we have been doing. I hope that's inspiring for other countries, which we would love to also to see them progressing and advancing in the same way as Rwanda is doing. And yeah, I hope you enjoy all this session, and yeah, let's see.
Yeah, sometimes I wish I were Rwandese. Rwanda is doing a lot of great things and setting the stage, laying down the marker basically for the rest of the continent. And I think there's a lot that we can learn. So thank you, Manuel, for providing that context. Next, it is my distinct honor and privilege to welcome our keynote speaker. His name is Prof. Nikes Ndembi. He is the Deputy Director General and Inaugural Director of IVI Africa Regional Office. He's overseeing their operational, scientific, and partnership activities in the Africa region, including the Africa Regional Office in Kigali and the country office in Nairobi, Kenya. He's based right here in Kigali, and he has over 20 years of productive research on HIV and AIDS, mainly on viral evolution, drug resistance, development of novel clinical assays, and pandemic prevention, preparedness, and response. Prof. Ndembi, please put your hands together for me.
Okay. No, thank you so much. Maybe let me have the mic. So I think it's a privilege to be in Rwanda, particularly in Kigali. I think this is a nice place to be to discuss this topic. I was discussing with Seth, if we have more Rwanda countries in Africa like Rwanda, probably we're going to hit the target by 2040. So slide, please. So I think we all know the ambitious target of the African Union, which is manufacturing 60% of the vaccines by 2040. So I think the assignment we have today is probably, given the current landscape, can we really achieve that target by 2040? I think that's a very difficult question. But more importantly, we have partners in the room that can enable us to achieve that target if we work collaboratively. I think it's a very segmented ecosystem. But again, I'm going to bring a little bit of flavor of what going to be our enablers that will be required for us to meet that target. First slide, please. Slide. Or I'm the one moving the slide here. Seems like, yeah, good, thanks. So let me first, so that we can visualize this. This is where we want to be by 2040. And it's important that we crystallize it where really we want to be, because with the end really goal in mind, we can definitely see whether we can reach that target. So when we did this assessment during COVID-19 pandemic, probably not a good time to do an assessment of such, but again, very important, all the lessons learned, is that 99% of the vaccines on the continent are actually imported, only 1% produced. But honestly, it's not a cheap business. And it's going to be requiring some risk. Who's going to take the risk to invest into to shift the needles? We have to ask that question. And given also the current financial landscape, you understand it's becoming more challenging. Then we said, okay, I mean, by 2030, let's aim to be here, and then 2040. But let me remind you, targets are not said to be achieved. They are said to be challenged. When you say 95, 95, 95 for HIV, you all know that, right? It's not easy to get there, but again, it's to push, to be sure that we're constantly challenged. If we say 2% by 2040, it's done the following year. So at least in my lifetime, I'm not going to see whether we have achieved, oh, maybe I'm just too early enough to say that. But again, usually those targets, we need to be sure that they are challenged. I mean, we can definitely put in a lot there. So the 2063 agenda, we've talked about it during this meeting. But again, that's the blueprint to be able to really provide a health or safetier health for our own continent. Manuel talked about this. I'm not going to talk about it again, but the enablers are there: financing, the regulatory system, the volumes. Because said we talk about the volume. When you choose an antigen, you need to know it's viable. Is it a viable business? So the market shaping and that demand intelligence in the context of vaccine hesitancy. We need to be very careful which antigen we go for. I mean, it's not a cheap business. You get it done right, you get it. If you don't get it, you close the business. So we need to train people. There's a shortage of about 14,000 really Africans, let's put it that way, to be able to meet that target. Where are we to get this talent to be able to reach this one? So we decided to put a little bit that again into context. Look at this map, and you can see that the red ones in the global and even the low middle income countries, more precisely in this discussion, Africa, represent the private sector. Okay, if you look at upstreams, you see virtually, except the regulatory environment, the private sector is contributing significantly or involved across the value chain. That is where we need to think twice. And we need to come with a business model based on this. Are we doing a blended 60%, probably private sector, 20% government for ownership, another 20% for the philanthropist? We need to think about it, given the current financing environment. I think this line, when I start comparing what we have in Africa versus the global, you can see clearly that we're actually trying to diversify in the global compared to the low middle income countries in general Africa. So I think this is very a good exercise, and thanks to Samuel, because we had to sit down and reflect on it. What is the real contribution of the private sector? So let me get a case study from IVI. IVI, we actually set our mission: discover, develop, deliver. That's our mission, the 3 Ds. So really on the top, that upper top really table, you can see the antigens we are working with, very diversified. Also the fact that we're dealing with really working end-to-end, covering the whole entire ecosystem from epidemiology to really vaccine delivery. At the bottom you see more than 60, at least countries and governments have ratified or are in the process of ratifying the IVI treaty. That's very important because again, that comes into what we've said, really endorsement and really ownership from our government. On the left, I think the left side you have the map and the footprint. We are in Africa, we are all in Latin America, I think across the globe with the headquarters in Seoul, and then office in European office in Stockholm, and the African office out of Kigali. But again, how do we contribute to the entire ecosystem? I think this is, I mentioned it, our missions and visions, but again, expanding the footprint, being sure we're closer to our member state to be able to support them achieving or really advancing end-to-end local manufacturing. We scale our global really footprint and be sure how do we future-proof governance, and also ensuring that we're part of the solutions in a nutshell. And this is quite significant in the vaccine manufacturing field. So in Africa, we have 3 states that actually really 2 states that are signatories, and then 3 states that are signatory, 2 states that are signatory, 3 states that are parties, and 8 countries that are in the process of ratification. And you can see over 21 projects across the continent and 3 collaborating centers in Ethiopia. Hopefully we can get one manual here in Kigali. And we can say Ghana as well. And the most important thing here is that we've been able to really support those member states to be able to build their capabilities. So in the nutshell, if you look at the footprint, we are almost in the 5 African Union geographic regions. So in terms of vaccines, there are 3 vaccines that we've been able to, so far at least, move the needle from discovery, development, and delivery. The oral cholera vaccines, you're all familiar, and there's a global shortage on oral cholera vaccines. And we are working closely with our member state to be sure that we really support them in tech transfer. In the case of BioVac in South Africa. The second vaccines that we've been really, we've been successful being able to move it up to really pre-qualification is the typhoid vaccines. And then lastly, the non-typhoidal Salmonella Shigella. And there are more and more vaccines that we have in our pipelines within the International Vaccine Institute. So, and these investments, you can see, I mentioned earlier, they are not cheap at all. You have to invest into. And this is a call really for research and development, science and innovation, which drives what we mentioned here earlier, tech transfer and IP. So those are our partners. If you look across the list, it's quite diverse, and it covers really a broad range of partners, including the industry, of course the private sector, the academia, all actually contributing significantly to the mission and vision of IVI. So before I move to what we're doing on the continent to address those questions, you can see clearly what we have been able to achieve from our own program. 150 million doses shipped globally from the cholera vaccine so far, the 3 vaccines that I presented earlier. The vaccine discovery, more than 180 projects. From the AP side, more than 20 projects. 14 tech transfer with 6 really around vaccine and more than 40 clinical trials. 5 vaccines that are product pre-qualified by WHO, which is important again to access to the global market. Training, human capital development, more than 8,000 professionals trained on-site and online. And then over publication of over 1,000 publications. Now, on the continent, what do we do? Clearly, we have established an office out of Nairobi to really tackle the issue of end-to-end capability. I mean, it's important. I think this is undeniable and based on the enablers that we all mentioned earlier. So we agree we need to move that needle from 1% to 60% by 2040. But in addressing this, we need to be sure we also tackle issues around pandemic preparedness and prevention, which is important in case of an emergency, that we tackle issues around endemic diseases on the continent. Mpox is a call, COVID-19, cholera, those preventable diseases, being sure that we have those tools in our toolkits to be able to address those emergencies when they're available. That will also improve the supply security. So we operate on the PDP, or a private a PDP model, a product development partnership, working closely with our partners. We don't bring funds and just drop with the partners to be able to really move with, develop their research capabilities. We work hand in hand. And then when I mean it, I mean it. So the staff from the facilities going to be trained at our facilities at Seoul, and then they go back to their own facilities. We move our technical expert to assist them at the site to build, again, on-site capabilities to be able to drive this. So it's a public-private partnership, and then it's really established to develop and provide access to new health products, particularly the vaccines, but that can be expanded on the topics around therapeutics and diagnostics. That's the combined expertise, as I mentioned. We really learn from each other in this process. It's a respectful-oriented partnership, and we spread funding, really, and risk across the multiple stakeholders, and we facilitate dissemination of knowledge across the diverse network, and then concentrate on product development that are viable. So IVI also as a successful multilateral partnerships. We trust in multilateralism. That's very important. And we really, as I mentioned, committed for local capabilities. The biomanufacturing training hub that we have in Seoul that have trained over 3,000 people globally. The tech transfer I mentioned earlier. And then the efficient, cost-effective and development vaccine that we develop. It's important to have the vaccines, but again, you have to be, Manuel mentioned about it, the economy of scales. These vaccines, they have to be affordable. They can be deployed in low, middle-income countries. I think this is again one of the strengths, developing vaccines for low, middle-income countries. So, as actually I really conclude here, I think this gives you a little bit of flavor on the roadmap in terms of the support on capacity and capability building on the continent. You need a robust R&D and clinical trial development system. It has to be funded. We talked about it extensively this morning and in a couple of other presentations. Without research and development, it's going to be challenging to move the needle from 1% to 60%. It doesn't come by night. You need to invest into. There are no two ways for that. Put in resources, involve in science and innovation, you get product, you can move them like IVI and what we're doing currently with the two products that I mentioned, the three products that I mentioned, and the two that we're about to transfer to local manufacturers. That will require substantial funding. Nobody can tell you something different around R&D. That is a must. We need to invest. Either we involve with partners, the private sector, government also in terms of ownership to be able to drive that. It's extremely important. Tech transfer is linked to R&D, right? And also IP, of course. And then we all know the debate currently happening, the pandemic treaty, TRIPS, and all those, all are linked, and the bottom line is around IP and tech transfer. You need to own it, you need to fund it. So the regulatory environment, we've heard from Manuel and others from the day one, the regulatory system. We don't want made in Africa vaccines that would not be acceptable globally. That's where the market is. Do we have the market on the continent to focus? No. We need to really be sure these products are competitive globally. That's why those global standards are being set for Gavi, UNICEF, and the major procurers to tap into when there's a need. The yellow fever vaccine is a very good case study where we have products that has a WHO pre-qualification. You can get the vaccines across the globe. The demand generation, absolutely important. We cannot manufacture the vaccines when the community is not prepared and ready to accept those vaccines. We have to do and work on it. I think this is important. Again, it's part of engaging the community from the clinical trial side. How many clinical trials have we really been able? We saw 2%, 3%. It means that we are bringing a product, a finished product to the community. They have to be part of that discussion. And I always get a good example, the Sisonke clinical trial. During COVID, I think it was a very good example, 40,000 people in the trial to be able to support the findings from the continent to be able to drive, again, that demand generation. So the manufacturing, the facilities, I think for those who are coming from other countries, the water, electricity is a problem. We need to fix that. I think this is part of the solution and the enablers. Because I said it from the beginning, it's not a cheap business. It's not a cheap business. It's very expensive. I think, again, if we fix water, fix power supplies, then we can actually give the better tools to our scientists when they are funded, of course, to be able to run those projects and successfully implement and manufacture. It is not a plug and play. Because I think maybe I'm speaking to the converted, but again, the message here is that we need to invest into local manufacturing and then from the research, development, and science and innovation. And delivery, of course, which are linked to what I've said. I'm going to close here with this good example. So this is Biovac. We're completing the tech transfer of the oral cholera vaccines, which was developed by IVI. So you can see we're pairing really with the local investigators, okay, from the disease surveillance, evidence generation, even advocacy. We're saying that because people have to be aware it's happening, that is doable, and we can actually move on. You need to do some studies, the toxicology studies, now currently being done or completed from our own facilities and lab sold. We bring it back to South Africa. We do the same with our investigators, pair in pair, to be sure that actually there's a transfer of capability and experience to the local investigators. And then the clinical trials executions, of course, when we move there, we involve the community. Because it's important. They have to be part of that solution. So that when the product is made in South Africa, then, you know, oh, yeah, we're part of this, we're involved into this, and it's something that we contributed to. And then the tech transfer, and then WHO pre-qualification, and then the support at scale for Biovac to produce a cholera vaccine. Why cholera vaccine? I mentioned there's a global shortage, and there's no manufacturers on the continent to address this issue that actually reoccur in more than 20 member states experiencing really outbreaks of cholera. To conclude, these are the sites, these are the support, the manufacturer support to the Institute Pasteur of Dakar for vaccine clinical development and trainings, training of trainers to be sure that they also have a multiplier effect. Afrigen, we're moving with the Rift Valley fever vaccines. Biovac, I mentioned, oral cholera vaccine. Ghana, we're also moving towards that. Biovacs in Kenya, where my colleagues on that has been based, building also their capabilities. On clinical trials, you could see a long list moving from cholera, typhoid, schistosomiasis, Rift Valley, and Lassa fever. You recall Lassa fever is also an endemic disease in West Africa, which will require really solutions. CP, IVI, and multiple stakeholders are working towards, and the training. You train and retain those staff. The Global Training Hub, the IVI vaccinology course that we're organizing in September, that's going to be on a rotational basis in several countries on the continent to build their capabilities. And then the centers that I mentioned earlier, our really research centers of excellence, and of course, being sure that we're all part of the solution. So, in summary, thank you, Samuel. I see you there. So, we are here, the private sector. In conclusion, you can see clearly they are a good vehicle for execution. If you look at all manufacturers, at least those that will be successful, we know, about 5, at least 4 are owned by the private sector. At least. Except probably Vaxera in Egypt, the share probably could be from the government, the major, really. So they're a good vehicle. It means that we need to find a better way to provide a conducive environment for the private sector to be able to be a catalytic factor across the ecosystem. It's agile, they can mobilize, no bureaucracy, of course, because they are dollars-oriented. They have time-bound them. They can take risk, which government are less likely to take. And decision-making, it's usually a very clear line, because it's business-oriented. The R&D, I mentioned it, commercialization. When you see business there, you go for it. We need to think through that and see how we can build. And then talent retention, they can easily put in resources to retain their staff in a competitive environment. Thank you so much for inviting me, and looking forward to the questions.
Prof is an academic, so you can forgive him for being super passionate about this topic, and I think he was excellent. Thank you so much. A round of applause for Prof. Ndembi for setting the context. And now, my distinct honor to welcome the panelists to the stage. Let's start with Zweli Bashman. He is the Managing Director for MSD Sub-Saharan Africa. Please put your hands together for Zweli. Please take your seat. We have Kelly O'Donovan. She is the Managing Director for Sartorius South Africa Limited. Please put your hands together for her as well. We have John Wilson Nigena. He is the Director of Supply Chain Management and Logistics at BioNTech Rwanda. Put your hands together for him as well. And last but not least, the legendary Dr. Seth Berkley, who is a Senior Advisor at the Pandemic Center at Brown University. Please put your hands together for Seth. Oh, all right, I think you can hear me now. Great. It's good to have all of you right here in the panel, representing private sector and different aspects of vaccine innovation. So let's start with, I'll call it a soft landing. I'm sure all of you are working on something exciting in the vaccine innovation ecosystem. So let's start with you, Zweli. What are you working on?
Good afternoon, everyone. I think for me, our organization is really focused on the expanding access to the most innovative vaccines that we have. So the number one thing that I'm quite passionate about is the work that we're doing with UNICEF and Gavi, where we vaccinate approximately about 18 million girls across 28 different African countries on the continent. And the next phase that we're looking at is really making sure that we're able to avail the nanovalent HPV vaccine to as many African countries as possible. That requires us to have a very aggressive access-orientated mindset to ensure financial sustainability of expansion of that program, but also engaging partners such as UNICEF, Gavi, WHO to ensure that they are aligned with our thinking. The other really exciting thing is the work we're doing in Ebola. I think we recently saw the WHO SAGE really calling for the expansion of the rollout of the Ebola vaccine, which we were one of the pioneers of. And so we really are looking at ensuring that we're able to avail the Ebola vaccine to tier 1, tier 2 countries, as well as first-line responders, et cetera, which is quite exciting, I think.
Great job on working on vaccine access and equity. Kelly.
Thank you. So Sartorius is committed to supporting the localization of vaccine research, development, of course, and manufacture across the African continent. So some of the exciting initiatives that we're working on, we are supporting from a very early stage at research institutes and universities with specialized packages which are incorporating hardware, consumables, services, as well as sharing our expertise, all at very reduced pricing to support the early stage research. And these are specially developed for the academia. We're also collaborating with institutes and centers, for example, the CSIR in South Africa, Uvu Bio here in Rwanda, as well as IPD in Senegal. We're collaborating with them to enable them to further develop vaccines. Our collaborations include financial investment, as well as providing, again, our expertise and sharing our know-how. So we are sending our specialists to the customer site to work hand in hand and provide the necessary training at these centers. Another great initiative we have been working on is to partner also with training centers. So as mentioned, we need to really develop the skills, and we have to upskill the local talent. So we are working here also with partners like Uvubio and IPD to really establish the workforce in the field of bioprocessing. We're sharing, again, it's our knowledge, our know-how, both the theory as well as the practical sessions with young, enthusiastic attendees from all over Africa. Yep.
Yeah, no, thank you. And I mean, a number of things stood out. So you talked about localization of vaccine manufacturing, you talked about collaboration and partnerships for training. I think those are all really, really important. John?
Yes.
What exciting thing are you working on at BioNTech?
Thank you so much.
The pride of Africa, if I might ask.
Thank you so much. BioNTech as a new biotechnology company, I think as we are mainly committed on improving the health of people worldwide, so which is the driving force behind our work on immunotherapy for cancer and infectious disease. So while we remain a cancer company or oncology company, we have exciting infectious disease program. Currently, we are working on developing potential disrupting neutral against the unfinished global health agenda for TB, malaria, and HIV, which still, of course, encounter a lot of cases and deaths each year. So, and apart from that, BioNTech is also ready to respond to new diseases with pandemic potential. And currently, we are working on developing an mpox candidate. We are also conducting clinical trials for TB in South Africa, and we are looking forward to expand that, those studies across the continent later this year. Our aim is to translate our best science into public health impact with a sense of urgency. And to do that, our approach, we mainly, on the global health, we mainly work in partnership with those whom we share the same vision. I'll give an example, for example, co-investment with the Coalition for Epidemic Preparedness Innovation, like CEPI, Prof mentioned that, and the GATE Foundation, which has enabled us to accelerate our program, and will facilitate, of course, access to those at-risk population who most need our vaccines. We're also closely engaging with global partners like World Health Organization, Gavi, regional also organizations like African CDC, and of course our research partner and site. And we are looking forward to engage more in the coming years as our candidate progress.
Yeah, thank you very much, John. And I think what stood out is the versatility of this mRNA facility that you have to not just work on emerging or new kinds of diseases, but also the existing ones, TB and all the other things that we continue to deal with across this continent. Seth.
So thank you, and I think most people know me from my work at Gavi and COVAX and IAVI, and when I decided to step down from those, I wanted to continue to do exactly the same thing, but do it partially from the other side. So I'm working with 11 different companies now, everything from small to large on the IVI board. But just to give you a couple of examples of why I'm so excited, you know, I work on I'm on the board of a company called A Priori Bio, which uses AI to create an engine that looks at immunologic pressure and what does that do to viruses? Why does the viruses mutate and where do they go? So the idea is that you can look at where the virus is going to be in the future rather than say, oh, you know, what happened in countries last year and let's prepare for that. And using technology is so powerful We have new microneedle patches that can be self-administered and that are temperature stable, et cetera, et cetera. So this is important. On the other extreme, working with people like the Serum Institute of India, which is the largest manufacturer in the world, to try to figure out how to get those vaccines at a lower cost available, worldwide, including through localization and technology transfer to countries, including here on the African continent. But I think, for me, vaccines are magical in what they can do, and the real challenge is how we follow the science and keep moving to create the tools we need for the future. Some of the vaccines we have aren't perfect. We need better vaccines. You've already heard from that in terms of, certainly we need an HIV vaccine, malaria, TB, better vaccines, but we do have vaccines out there and we need to make sure that they get out to everybody who needs them, as we discussed in the previous panel.
They were very important, and I like what you said, follow the science, because unfortunately not everyone believes in science anymore. I don't, well, that's a conversation for another day.
So to your comment previously,
yes.
Senator Patrick Moynihan said, everybody's entitled to their own opinion, but they're not entitled to their own facts. So this idea of alternate facts is a real problem, and it's had a dramatic effect in the world, and we really do. This is one of the fundamental problems we have to deal with.
Absolutely. Sad, but a reality. So let's turn to you, back to you, John. So now we have this Africa's first ever mRNA manufacturing facility. And I think there are plans to scale that to the rest of the continent. But what challenges do you think might arise in this process, and how can we overcome them?
Yeah, I think our BioNTech commitment to establishing like manufacturing facility for mRNA is a significant step toward addressing healthcare issues or challenges that we have in Africa. Especially in vaccine manufacturing. And of course, this initiative goes with a lot of challenges, which I think the public or private sector could be engaged in and provide a lot of solution. Because expanding mRNA vaccine require a lot of effort. And so if we are planning to do so in Africa, there are quite a lot of things that need to be done. There are quite a lot of infrastructure that are required and capacity. So those are the things that I think the private sector, could be really crucial in terms of finding a solution. So one of those challenges lies in infrastructure and logistics, because like Africa, with our landscape, but we often have a lot of challenges. For example, like electricity, which is not reliable. We have a transportation issue. We have, when it comes to storage systems, we also have challenges for distribution of sensitive commodities, especially when it comes to mRNA vaccine. So to tackle these challenges, I think there's a need for the private sector to invest in logistic network and also to improve the storage and the cold chain condition, and also partner with the tech companies to develop efficient storage and transportation solutions, of course, to ensure that the vaccine arrives to the most in need. The other challenge that I think, or the other hurdle that I think is the shortage of skilled workforce in mRNA, especially vaccine manufacturing sector, and also across all functions, like supply chain and logistics. So for us as BioNTech, what we did, we are one of the first mRNA vaccine manufacturing company in Africa. So what we did was to pioneer in terms of bringing innovation in the capability building initiative and the frameworks to ensure that our current and the future workforce have the capability that we need. And the thing we did is partnering with, or working with our university partner to develop like some of the fundamental mRNA vaccine knowledge through form module that we have developed with a partnership in the university. We're also planning to work with local university and institution to develop or to establish internship programs, especially for the graduate and the students, so that they have at least first-hand technical experiences on the vaccine manufacturing. The other thing, also, of course, securing funding for scaling up mRNA vaccine is another challenge, which, because, of course, doing this require a lot of costs. So I think also private companies and the international organizations and the philanthropists entities can, and some of them have already started providing financing support to partnership and investment. I mentioned CEPI, I mentioned Get a Foundation, and for this mRNA capability. Lastly, I think one other thing is the access to material and the supply chain, raw material, and the supply chain in general, which is critical because most of the raw material are produced outside of Africa. So that dependence on the global suppliers, it's a big challenge. Yeah. And I think the involvement of private sector is needed in terms of investing, of course, in collaboration with the company and Africa organization to help also supply chain through partnership or through establishment of the local manufacturing. The other thing, I think we talked about it before, and Manuel mentioned it, is the regulatory framework and the policy, because to establish vaccine manufacturing plant or plant require a lot of approvals, a lot of regulatory requirements, and which is not easy to get. So I think private also can pick on what the governments are doing in Africa. Manuel mentioned about Rwanda, and also work with international organizations, WHO, African CDC, to make sure that there are synergy and effort to easier and to streamline the regulatory approvals, and also make sure there are really clear processes. So in brief, I think private sector engagement is essential, and in overcoming those challenges that I mentioned, and also advancing mRNA vaccine manufacturing across the continent.
Yeah, no, thank you, John. I think very important points on infrastructure capacity, logistics, the skilled workforce. And Kelly, turning to you, so mRNA is an emerging technology platform, but we have traditional platforms that I'm sure Sartorius is very well versed in. I suspect that some of the challenges are similar, but anything you would like to add, and what ideas do you have for solutions?
Yes, thank you. As John's highlighted, obviously there are some challenges. So traditional vaccine platforms, while having demonstrated efficiency for several diseases, can also be very limiting. So typically the development is very long, the facilities needed are extremely large, and the investment into the infrastructure is significant. Furthermore, the traditional platforms are not adaptable or flexible. So a flexible platform such as mRNA has the ability and the potential to be adapted in a short amount of time to address a wider range of diseases. So Sartorius technology is supporting the production of traditional vaccines as well as emerging technologies. This is helping the industry to address both global endemic diseases and less predictable but potentially devastating localized outbreaks. Strategies for vaccine manufacturing have evolved in the last couple of decades. At present, there are multiple different platforms available for vaccine developers. As a partner of the vaccine industry, Sartorius is committed to providing solutions for developing vaccines across all of these platforms. So the private sector definitely has a role to play here, especially as partners to the producers in terms of bringing those technologies, essentially the raw materials, closer to the regions. So for example, Sartorius has invested into an entity in South Africa in 2019 with the vision to be a hub for sub-Saharan Africa. And as the region develops and vaccine manufacturing is established, we too have visions to open additional service locations to meet the growing needs of our customers. Furthermore, Sartorius is also committed to developing our technologies even further to help reduce the overall costs of producing vaccines. We look how to accelerate process development and implement highly productive, cost-effective commercial processes with reduced manufacturing footprint. Our process development specialists are available to our customers to deep dive into their processes and provide expert advice on how they can be optimized through innovations, smart tools, and industry trends, such as process intensification. So we are working together with our customers to gain higher productivity whilst lowering the cost and moving towards a more environmentally and sustainable manufacturing.
Great, no, thank you, Kelly. So lower cost, higher productivity, working in partnership and providing the technical support that your clients need. One of the points that John made was around the shortage of skilled workers, so to say. So let me turn to you, Zweli. What kind of initiatives do you think we need as a continent to sort of scale up or ramp up or upskill R&D for vaccines?
It's a good question. I think I tried to keep count when the good professor was talking in his session, how many times he mentioned the fact that this was a high cost and very expensive activity.
Yeah.
And to contextualize that for you, if you look at 2023, our organization invested over $30 billion in R&D in just that year.
Wow.
And the nature of how the pharmaceutical regulatory landscape is structured in the market is that you're only really going to recoup on that investment in 5 to 10 years' time. And so it's important that as we think about this, we don't lose the meaning of that word investment, because the return is critically important. And so what I think is important in this sphere is that we have to start creating and building Africa to be an environment that is accepting of innovation. Because R&D investment is funneled towards places that accept innovation and easily right at the beginning. So there's a couple of things that we're doing in this regard. We're talking to a couple of countries now, Botswana, Rwanda, around the importance of pooled procurement. Coalesce volumes and use that as a negotiating tool in order to gain access to better pricing, as well as product much earlier in the life cycle. It's nothing new. It's actually what Gavi does in the vaccine ecosystem. We're trying to spread that into spaces like oncology and cancer care. The other thing, which we often forget, is to utilize clinical trials. We've got about 1,250 clinical trials running across the continent. And what people forget is that clinical trials are actually an avenue for early access. And so in attending, I was really, really proud of just listening to the Africa Clinical Trial Network launch yesterday. Because as I was listening to that, it becomes a platform that is, let's call it non-partisan from a private sector perspective, where multiple organizations can contribute towards building this ecosystem that's going to allow us as business leaders, because I always say to people, there's two aspects to my job. The one part, which is 50% of it, I advocate for my organization across the continent. The second part of my job is to advocate for the continent within my organization. And by creating this network, it makes it easier for me to say, here we've got a network that stretches across the continent. It gives us the clinical trial diversity that we need, and we can be assured of the fact that it will allow for the highest levels of quality. And so I think it's those kind of contributions that the private sector can do. And also, just speaking to this element of the investment aspect to it. People often chuckle when I tell them that my clinical trial team is bigger than my commercial team, almost twice the size. They are much more qualified, much better paid, and they do what I think is an incredibly taxing job. I witnessed them in action in the middle of COVID. When all of us were working from home, these people were on the front line. And so I think we have to take that into consideration, that it's not a cosmetic exercise. It's really a deep exercise that requires a significant amount of investment. And those investments will only come if we can tangibly show that they will generate returns.
Oh, very important points. There has to be a clear return on investment for the private sector, and I guess for everyone.
For all involved.
For everyone involved, absolutely. So as we conclude, and I really want to open this up to the audience, Seth, so sort of building on Prof. Ndembi's keynote, maybe I think all of this will be nothing if we can't figure out a way to build a sustainable ecosystem for vaccine innovation. So the key word is sustainability. How do we go about that?
That is correct. And just to say a word on the manufacturing side, we need to have the world-class quality, which Prof said, and quality is getting more and more difficult as people are trying to search for less, lower and lower risk in the system, and that is a challenge for everybody. But what we need to do is make sure that we are cost-effective in what we do. And just to remind people that the vaccines that serve the world are mostly not mRNA vaccines. So mRNA is a new technology, but we have existing vaccines that are inexpensive, that don't have problems with cold chain, that are stable and can serve the population. So we really need to do that. On the sustainability question, Prof and I were talking about this because when there was this new push to try to bring COVID vaccines, initially it was 33 different manufacturing efforts that picked up. And they were all directed at COVID. And of course, we didn't need 33 new COVID plants. We probably didn't need any at that point, given where the capacity was. So what we need is to take a tough decision that says there's going to be a small number of new manufacturers, long time, deep investment, and what they have to do is to get to a certain quantity. And so what you don't want, if there's 3 or 5 manufacturers, to say all 3 or 5 are making the same product. What you want to do is say, let's look at the global marketplace, let's see where there are gaps, let's go ahead and make products that are important for the continent, but also can be sold globally, and we can get to that economy of scale. The African Vaccine Manufacturing Accelerator that we put in place at Gavi before I left is at $1.2 billion. The purpose of that is to say the first vaccines that roll out of any new company are going to be more expensive. There's no question. It doesn't matter whether it's in New York or it's in Rwanda. So the question is, can you subsidize for a period of time those vaccines to make them competitive, but to force the manufacturers to get into that competitive space, because their goal has to be competitive. It can be a little bit more expensive for vaccine security, but you can't have vaccines that are 5 times the price because countries will not buy those. So this is the challenge that we have to do as we think about the ecosystem. And the last thing I'd say is we have to make sure that as we do that, we don't lose the existing manufacturers, because supply security means having a range of manufacturers around the world who are able to produce products in a cost-effective way.
Very important points. Thank you so much, Seth. And let's turn to the audience. Feel free if you have any comments, questions. Yes, I see a few hands. I don't know if our colleagues at the back can help with passing the mic around. Please just stand up, tell us introduce yourself, and then quickly make your comment or question. Yeah, a microphone is coming.
Thank you very much for a very inspiring discussion. I'd like to start I have 2 questions, one for the Sartorius colleague and then one for John. So John, there was a lot of...
Sorry, you didn't introduce yourself,
I'm
sir.
sorry. Yeah. Very sorry. I'm Patrick Lukule. I'm the Chief Operating Officer for Bio Usawa. We're going to start manufacturing monoclonal antibodies in Rwanda by end of the year into 2026. John, my first question for you is there was a lot of excitement about BioNTech right after COVID, or probably even during the COVID pandemic. That excitement seems to have waned a bit. Could you tell us perhaps what are your current plans, how they've been updated, and also, are you planning on actually making the finished product, or your focus is on the drug substance and you want to partner with others to do the finished product? Just some clarity on that. And then on Sartorius, as a comment, really happy to hear that you are developing programs to help build capacity for bioprocessing. We look forward to working with you. Obviously, the human capital deficit on the continent is something that is that we're very keen on, and it's on our minds. But having partners like yourself, who is not just providing equipment or maintenance, but actually helping to build a workforce and optimize processes, I think will really help to ensure that this is a sustainable business. Thank you.
Thank you. Let's take a few more, then you can respond. I see one hand right behind.
Thank you very much for the very inspiring discussion. My name is Caxton Murira. I represent the Science for Africa Foundation, and I lead a program called Clinical Research and Trials Community. One of my focus areas is increasing investments in clinical research in the continent. So as I was listening to Prof speaking, I did remember about during COVID, the CONCVAC initiative did try to put up a picture of the continents, you know, how the capacity is at in the continent in terms of, you know, vaccine studies that can happen in the continent, which clinical trial sites in the continent can conduct vaccine studies. And I think when we started, the number was around 100, which went around to 25 that were highlighted. And I think what for me is coming out of this discussion is how do we build the capacity of more clinical trial sites being capacitated to conduct industry standard, SRA stringent regulatory clinical trials. And it takes a lot of investment from the industry. So my question is, how does industry play a role in a space where, you know, return on investments should be guaranteed, you know, to build the capacity of these clinical trials, you know, to invest in, to conduct vaccine studies in the continent? Because ultimately, without the capacity, this does not happen. So building the capacity might take some time, but the ROI may not be, you know, directly achieved over a short period of time. So how do we make that connection, and how do we invest in that space to build that capacity? Thank you.
Thank you, Caxton. I see one more hand at the back. And so far, only the men are asking questions. The women don't get vaccinated? What's going on? All right, I see a hand. Thank you. Thank you for that.
Thank you very much. My name is Sophonius from Africa CDC. Thank you for the insightful discussions. I want to raise the issue of retention. I think there's a lot of discussion about building capacity. I think Africa has been building capacity for many years. But when do we retain them? And what is the role of private sector to retain this capacity that's being built or that's being planned to be built, and use that capacity to strengthen the vaccine ecosystem? And the second point that I want to raise is for John. You said Africa to receive innovations. And what do we need to do to actually make Africa an innovator, not just a receiver of innovation? Thank you.
Okay. Last question at the corner there.
Thank you. My name is Lona Tumwebazi. I'm a medical doctor. I'm from Uganda and work in the US. So I'm interested in what you're saying. Thank you, everyone, for what you've said. Great. So I have questions that are related, and one also relates to the keynote speaker. Thank you. That was a great presentation. And also to what Dr. Buckley indicated. So in an environment where we have contracted physical space, what existing ways is the private sector actually encouraging governments to do what Dr. has said, to have few but quality production of vaccines, so that we avoid governments individually each trying to produce the same vaccines, so that you have regional production and also pooled procurement, so that governments can benefit from that, because that also will help lower the prices, because you have markets from that rather than individual countries. And the last one for me is really about preparing the countries in contracted fiscal space. We have focused, and you have, the keynote speaker did actually emphasize this is very expensive. And we've mostly focused on the manufacturing. Somebody talked about the demand. This is the time for governments to actually think of manufacturing and across the value chain to when the vaccine gets into the human body. So how do we actually work with governments and the private sector, public-private sector partnerships, so that the governments build on their existing systems, so that when these new products or new tools or vaccines come, we avoid verticalization of introduction of single vaccines, which is more expensive than if you build an infrastructure that prepares the governments to actually uptake any vaccine or any tool that comes on the market, which would be in the long run cost effective. Thank you.
Very important questions, almost like a thesis for some of you, but good luck. I don't envy you. But maybe we'll start with you, John. I know there are a few questions that read your way around what next for BioNTech in the aftermath of COVID, and how does Africa move from being a net receiver of innovation to be a net exporter of innovation?
Thank you so much, and thank you to the audience. Thank you, Patrick. Regarding BioNTech, to your question, where's next for BioNTech, as I mentioned during my presentation, early, I said that BioNTech is mainly an oncology company. But however, I think we were popular during the COVID time because of our COVID vaccine that we developed with our partner that saved a million lives globally. And currently, as I mentioned, I think we're also working on other pandemic vaccine candidates like Mpox. I mentioned Mpox, but also have a very exciting infectious disease program that we are working on. I mentioned the HIV, malaria, and TB. And as I said, we are also conducting, for example, clinical trial in South Africa on our TB candidate. But mainly, our company focuses on oncology and immunotherapy cancers. And we are currently also have a lot of work ongoing on that particular topic. But apart from that, infectious disease and the pandemic-related topic are also part of our scope.
Yeah.
And to the second question, innovation. Yeah, I think today the topic is about what could be the role of the private sector, and I think that's where we should start from, like partnership or engaging more and more the private sector to get more involved in these topics of creating innovation, a global hub innovation, and also working in partnership with our governments and regional organizations like Africa CDC and the other organization, and also learning from what has been done, but also look at how we can create our own innovations, and that can help drive our own initiative and the policies to make sure that we address African challenges.
Great. No, thank you very much, John. Seth, did you want to take the last two questions?
So one of the questions was, could we have multiple introductions of vaccines? And I have to say, one of the challenges is you have to get all the way down to the health worker at the community level, who are not as well trained as necessarily health workers at a higher level. And so they need to go through detailed training, and it is different for different vaccines. So it is one of the challenges. Yes, it's true that it seems inefficient to do a different training for the malaria vaccine than the cholera vaccine, but they're different delivery systems, they have different side effects, you have to look for different patient populations, et cetera, et cetera. So it's an important part of it. A second point I want to make is, if you go back to the vaccine manufacturing, when we started having this conversation, many political heads of state said, we should manufacture it because it's going to be cheaper, because our labor costs are cheaper. Well, the answer is no. The cost of vaccine production is basically the same everywhere in the world, and sometimes it's even a little bit more expensive because you have to import the materials and equipment that's there for the same quality. This is not true for clinical trials, and that's why I'm really excited that this network is coming together. There has been, over the last couple of decades, enormous training of capacity here. The challenge is, what you want are, large-scale university research programs and others, and there hasn't been as much of that, but there have been a lot of great research institutions that have been here for 20, 30 years, have done amazing clinical trials, and so we have people that have enormous experience, and the challenge now is to make that available. That can be a way to reduce dramatically the cost of these clinical trials. So, I mentioned, my work in India. I mean, the facilities are FDA, EMA approved, same quality everywhere in the world, but the clinical trials in India are cheaper because the labor costs are cheaper, and you work with the clinical system, which has lower cost, et cetera. So this is an area where Africa can, create their own properties of moving this field forward to accelerate all the products that are going to occur at a more cost-effective way.
We're running out of time, so I don't know, Zweli, did you want to take the last question on retention and brain drain? Do you have any?
So I think the key thing around retention for me, because it's a broad issue across the healthcare ecosystem on the continent, the key thing is we have to build industry. And industry is around consistency, the ability to replicate processes, and the ability to, confirm certain levels of quality. And so until we do that, we are always going to be in this trading mode. It doesn't matter what we do, whether it be manufacturing on vaccines, whether it be on the clinical trial side, it's always going to be haphazard. And that's why I love the work that the Prof is doing. The other question that was asked was around government alignment. I remember I was at a WHO meeting and I was standing in between a health attaché from South Africa and a health attaché from Botswana. And as I turned this side, this one is asking me to build a manufacturing plant. I turned this side, this one is asking me the same thing. I stood back and I said, discuss it amongst yourselves. Yeah. And that's what I think needs to happen. There has to be a continental, and at the very least, a regional level sort of approach around, number one, what will we manufacture? And that's why I love the work that the Prof is doing. And also where that will be manufactured. The next thing that needs to happen is governments then need to accept the burden of procurement. If it's manufactured on the continent, then we need to consume it. I'm great friends with the CEO of BioVac, and I walked a very tough journey with him when I was the president of the South African pharmaceutical industry, when their biggest volume item got removed in a tender, for whatever reasons there may have been. But I don't think that was the right decision to make for the sustainability of manufacturing in the country. And so we have to have these difficult conversations with policymakers and say, perhaps there's a different way of making these, accept the fact that you have to buy. Yeah. How you do it, we can have a discussion around it. And then, as I said, building industry really is going to ensure that we have continuity into the future.
They bought it somewhere else because it was cheaper. And so the question is,
100%.
At what cost? Which is why I keep coming back to that in terms of the
fully agree with you.
Yeah.
Great. This has been excellent. Thank you very much. A round of applause for the panelists. And as we close, allow me to invite Dr. Teresa Soup. She's the Senior Research Advisor and First Secretary at the Embassy of Sweden in Kigali, to give us our closing remarks. Yes, please. Please, a round of applause for Teresa.
It works. Well, thank you so much, Sam, for inviting me and for organizing this fantastic session, and to the panelists and the previous speakers with your really valuable insights. Thank you so much. So, hearing you, I think we all agree that local vaccine manufacturing is critical, and that we need all different kinds of actors to build the entire system, and looking at it from the community all the way up to manufacturing. So, yes, I work for the Swedish Development Agency, SIDA, and I'm based here at the Embassy of Sweden. So IDRC and ourselves, we have a history of working together. And I think we all know how important it is to have partner-led, or in this case, country-led or continental-led initiatives. That's how you get sustainability. And this is one of the reasons why I'm so happy to be involved in a program called the MAV+. I don't know if you've heard about it, but I'm going to tell you a bit about it going back to Rwanda, because this initiative was developed by the European Union in close collaboration with the African Union and the African CDC. And then there are a number of countries on the African continent working on it. Rwanda is one of them. So it was brought back to Rwanda and the priorities of the country, looking at the context and looking at what is needed, what's the priorities where, well, this kind of funding could come in. So we're looking at the system. We've talked about the regulatory aspects, and that's one very important part, but also to build an environment for both the private sector to work in, as well as research and development. Because in Rwanda, Rwanda wants to go end to end, from research and development all the way to manufacturing and eventually also fill and finish. So it's very important to look also at the skills. We brought it up several times today, the capacity to do all this. So we're also looking at new master's programs, short courses, training of people who would do clinical trials and being part of the manufacturing process, as well as research, postdocs, PhDs, etc. So I think it's really important to look at this part with the training, and the private sector has a very important role there. Some has been mentioned, but I can also imagine internships of students, having research collaborations already here, and also looking at the entire chain, including implementation research, etc. And we talked about innovation, so from universities, and especially in collaboration with industry, there can be innovations. So also some environment to take on these ideas, to build startups, and to develop them further in collaboration with bigger private sector. So we also look at the clinical trial sites. I'm really happy this came up. So part of this MAV+ program also contains a critical component on upgrading of the clinical trial sites in the country, so that they can take on testing of vaccines and other medicines locally produced, or those that are relevant for the context. Also, the International Vaccine Institute are involved in the clinical trial trainings, and ongoing right now, actually, together with the University of Rwanda and the Karolinska Institute of Sweden. So we've talked about vaccines as a golden star of global health. I like that expression this morning, but we all know that it only has an impact if there is vaccination. So in addition to looking at the manufacturing and all the research and development, IDRC together with SIDA, we're funding a small project, still it's in the planning phase, of research on vaccine uptake, so drivers of accepting or not accepting vaccines, and looking at the community health workers, how they're working with vaccines as well. So I think that covers some of the parts that have been discussed today. A lot of potential to collaborate with the private sector, and really I'm happy to see this catalytic role that private sector can have. And I must say, okay, so the panel, all of you sitting in this audience, gee, isn't it just amazing to be part of this fantastic journey where hopefully we will see a lot of more, I can't say this word, sovereignty of vaccine production and use on the continent. So thank you to all.